Everybody knows that medical terminology is going to have its origins in Greek and Latin. We have some terms which, don't come from the Greeks or from the Latin language, but nevertheless, the vast majority of what we think of as medical terminology has its history in Greek and Latin. And so, what we want to do is learn how to take root words, which are the foundation of a medical term, combine it with prefixes and suffixes, which give it specificity, and then make that into a medical term. And then also, when we see those same terms, create a very fast definition that gets the main points of the meaning across to us in our mind. Even if it doesn't give us a 100% definition of the word, it still gives us the gist of what the word is. And so when you all are in the field and when you are abstracting information from a patient chart, it's obviously going to be imperative that you have a solid understanding of what it is that you are looking at in their chart, but it's not necessarily imperative that you know everything there is to know about the medical term that you see. And so what we want to do is learn how to take medical terminology, assess what the root is, which gives us the foundation, and then in turn, prefixes and suffixes, which help modify the term to make it more specific. And so in chapter 1 in the McGraw-Hill resource, okay, and that's medical language for modern healthcare, we learn that the elements are going to be the elements of a medical term, I should say, are going to be the Greek and Latin combining forms or word root. Okay, the combining form is just the word root plus a combining vowel. And then we have, in addition, prefixes and suffixes. And so the prefix, of course, is the beginning of some terms. The root is the foundation that gives the word its meaning. We have the suffix, which is the ending of the term. And so when we are looking at various medical terms, let's say we are looking at a term such as dermatitis. And dermatitis is going to have as its root word dermato. And that's D-E-R-M-A-T/O. Okay. Dermato is going to be the combining form. And then at the end, we have the suffix I-T-I-S. Okay, dermatitis. Okay. Well, dermatitis, of course, is going to be an inflammation of the skin. And we can take the term dermato, the combining form, coupled with the suffix itis, which means inflammation, and get a quick definition of dermatitis. Okay, it literally means inflammation of the skin. Now, as we follow along in the McGraw-Hill resource, we're still in chapter 1. We talk about how to create terms out of combining forms, prefixes, and suffixes. And we just turned dermatitis, we just broke it down into dermato, which means skin, and then itis, which means inflammation. And then if we take a term like gynecology, or gynecologist, I should say, Gyneco is a combining form that means female. The combining vowel O is at the end of that to connect it to a suffix which starts with a consonant. Okay, in this case, logist. So a gynecologist is going to be gyneco, female. Logist is a suffix that means one who studies or one who specializes. So a gynecologist is going to be one who specializes in. If we continue and look down the page, respiratory. Respiratory. Respiro is a root that means breathing. In this case, instead of having an O as a combining form, we have an A, and then tori means relating to. So relating to breathing. And so if we think of the respiratory system or the respiratory system, we have relating to breathing. And of course, everybody knows that when you are breathing in and out, okay, you are utilizing your lungs, which are the main organ of the respiratory system. Now, as we continue through our resources on the McGraw-Hill site, we see cardiology. Cardiology. Cardiology is going to be the study of the heart. Cardio means heart. Logi, again, the study of. So cardiology means the study of the heart. Now, as we progress, we see a term like gastroenterology. Gastroenterology. Gastro is going to be a combining form that means stomach, while entero is a combining form that means intestine. But in this example, we have two combining forms. Gastro, again meaning stomach, entero meaning intestine. And then we connect logi at the end. And so we have a complex term. Its elements are two combining forms, gastro and entero, plus the suffix logi, and that gives us gastroenterology. Gastroenterology. Now, if you watch the videos that I created the last couple of days and sent to you, we learned that there are medical terms which are decodable and non-decodable. And decodable terms include terms like gastroenterology or cardiology. But terms which aren't decodable can't be broken down into combining forms, prefixes, and suffixes. And so yesterday, in one of the videos that I created, I talked about cataract. Okay, a cataract, for example, can't be broken down into a prefix, a suffix, and most importantly, a combining form which gives us the foundation. Instead, it is a term that we just have to know. Okay, and there are going to be some terms that we just have to know. Another category, and this isn't listed in the McGraw-Hill information, but I want to pass this on to you. Another category is going to be eponyms. Eponyms are often non-decodable. For example, one of the most famous eponyms is going to be Alzheimer's. Okay, that of course is a form of dementia, and it's named after the scientist that discovered this form of dementia, Alois Alzheimer. And Alzheimer obviously can't be broken down. It's a name, it's not a combining form, a prefix and a suffix. Now, if we continue with our McGraw-Hill resources, if we actually move into Chapter 2, where we get into suffixes and prefixes, here we're going to learn how we combine those two to make the terms that we already started to learn about in this course. We've got, this is table 2.1 of the McGraw-Hill resources. We've got a list of common suffixes, and an example would be itis. Itis, inflammation. Just like I mentioned a minute ago, dermatitis is a combining form with a combining form dermato and the suffix itis. That means an inflammation of the skin. Itis means inflammation. And that inflammation on the skin gives us an idea of why we may have redness and swelling, which is very prevalent when we do a review of systems when we're assessing our patient initially. By any chance, did you guys just gain the ability to see me? The GoToMeeting finally came up, but I don't know if it's actually working or not. No? Okay. Well, I'm still going to go ahead and just keep right on trucking along. Maybe it will eventually come to life for me. Okay. We have some other common suffixes. Logist. Logist is a common, very common in the healthcare field suffix that means one who specializes. Logy, L-O-G-Y, sounds very similar to logist, but in this case, it's the study of. Logist is one who studies. Logy is the study of. So if we had a dermatologist, okay, that would be one who specializes in the skin, whereas dermatology would be the study of the skin. Now, continuing in the McGraw-Hill resource, we have scopy. Scopy is going to be visual examination. Okay. Arthroscopy. Okay. Arthro is a combining form that means joint. Scopy means to view. So arthroscopy would be to view a joint or visual examination of a joint. Other suffixes associated with this chapter include desis. Desis. And desis is going to be a term that means fixation. Fixation of a joint would be arthrodesis. Okay, maybe somebody has to have a spinal fusion, and the spinal fusion leads to multiple vertebrae being fused together. So we would call that arthrodesis. Plasty. Plasty. When I was a little kid growing up, when I heard that so-and-so had plastic surgery, I thought they were literally using plastic to create a new facial feature or enhance a facial feature. I had no idea that plasty is simply a suffix which means surgical repair. So if somebody had an arthroplasty, that would be surgical repair of a joint. Now, continuing along, in Table 2.3 of the ebook of the McGraw-Hill resources, we get into diagnostic suffixes. And again, to diagnose is to get to the heart of a disease. And we have several of these that you will see routinely in a patient's medical history when you are abstracting information. And so the first one that we have on here is OMA. OMA means tumor or mass. Hematoma would be a collection of blood creating a mass. Okay. Hemato is a combining form that means blood. Hematoma, okay, hematoma would be a collection of blood that creates a mass. Urea, okay, the suffix urea means urine. Hematuria, that would mean blood in the urine. Okay, dialysis is to separate. Probably everybody has heard of or knows somebody that goes through hemodialysis, and in that case, hemodialysis is going to be separation from impurities, waste material from the blood. And in this case, we'll be talking about urea, which is the main component of urine. It's a waste product of urine. And so somebody that goes through hemodialysis would be having this waste material removed from their urine. Kezia. Okay, kezia is going to be referring to stool or the passing of stool, and hematokezia would be the passage of bloody stool. Crit is to separate, and of course people have always heard this term, a hematocrit. Hemato again means blood. Crit means to separate. So it's a separation of blood cells for testing. Gram. The suffix gram is a record. Okay, a cardiogram is a record derived from the heart. When somebody gets all those electrodes put on their chest, that ultimately produces a cardiogram, which is a record of the electrical activity of the heart. Graph, an instrument for recording. A cardiograph. Okay, that would be an instrument for recording the heart. The electrocardiograph would be an instrument that records the electrical activity associated with the heart. Lysis, destruction. Okay, the suffix lysis, L-Y-S-I-S, means destruction. Hemolysis would be destruction of red blood cells then. Okay, hemolysis. Philia, P-H-I-L-I-A, means attraction. Hemophilia. In this case, hemophilia, kind of deceiving. This is where sometimes medical terms, when you break them down, don't give you the full understanding of the term. Hemophilia is going to be a case of the disease hemophilia is going to be a case where a patient's blood does not stop to clot. Okay, they are missing essential factors keeping the blood from clotting. Okay, we typically think of, again, this suffix philia meaning an attraction. Okay, and you would think that would mean that the clotting cells would all come together. But in this case, that term is not quite giving us the full definition of what the word is. Ptysis is to spit. Okay, hemoptysis is to cough up bloody sputum or to cough up bloody spit. Okay, if somebody happens to have congestive heart failure. My background, not only have I been an instructor for many, many years, but I've also worked in cardiac rehabilitation for 20 some odd years. And my background working with patients that have congestive heart failure, many times if the congestive heart failure was not managed successfully, the patient would have hemoptysis, where they would actually spit up blood because because there was so much blood accumulating in their lungs that it would actually come up their windpipe and okay, so continuing along, hemorrhage. Hemo again means to bleed. The suffix rrhage, rage, okay, means to profusely flow. And in this case, when we talk about a hemorrhage, somebody is bleeding profusely. They're bleeding so much that the bleeding might even be uncontrollable. Okay. The next term, roid, hemorrhoid. Okay. Hemorrhoid could be a case where blood pools in the vessels of the anus and ultimately leads to swelling. Okay. Everybody hanging in there thus far? Good, good. Okay. When we're talking about this most basic information, okay, and again, this is how to build medical terms. And we talked about in chapter 1, the gist of chapter 1 was learning about combining forms. Those give us the foundation of the term. On the other hand, prefixes and suffixes are going to be important because they help to modify that foundation term. Okay, and for uses in the medical field, they really give us the specifics. And as people who are in medical coding, you guys, of course, know ICD-10 is known for its specifics. And that was the advantage of going to ICD-10 compared to ICD-9, was the fact that it was so much more specific than the previous coding system. And so having this thorough knowledge of medical terminology and anatomy and physiology gives you the specifics, which tailors very nicely into the way that ICD-10 is laid out. And so as we learn more about medical terminology, we're going to find out that it's this specificity associated with prefixes and suffixes in their attachment to the combining form, the foundation of the term, that really lets us speak the language and speak it among our colleagues and medical professionals from other fields and be able to communicate and get our points across. You know, one of the things when I'd worked with Dr. Miller before with people who were in the billing and coding field, and they would get something that was very vague from a practitioner, very vague from the physician, something that was very vague from the nurse practitioner or physician's assistant, and ultimately they would have to query the advanced provider and find out what it is specifically they were trying to disseminate in the patient's chart. And if you don't know the language, then it's really tough to pick up on the fact that something is out of place. And the team that I'm talking to right now, you guys are going to be probably the last set of trained eyes that put their eyes on a chart, and therefore you are doing the hospital a great service by being able to catch errors made by a multitude of healthcare practitioners when there is insufficient information. And having this knowledge and knowing how specific these terms are when they are associated with the medical terminology, that really gives you an advantage in your field in terms of meeting productivity and accuracy data, but also in terms of speeding up the submission of CMS 1500 forms, and in turn recouping the income from submission of those in a timely manner. And that, of course, ties in with revenue cycle management. So again, all of this is interrelated, and having such an outstanding level of knowledge in the field is going to be most beneficial for you. Now, one of the handouts that I had attached, and Dr. Miller said there were some issues with opening it up at first, but one of the things that I wanted to point out was a slide presentation that I had used before to teach anatomy and physiology and medical terminology. And it starts off with the 11 systems of the body. And from the brief overview of combining forms in Chapter 1 and prefixes and suffixes in Chapter 2, we can see how a multitude of information can be gained when we learn the prefixes and suffixes, as well as the combining forms that are most common when we discuss the 11 systems of the body. And so when we talk about the 11 systems of the body, the handout that I sent everybody, the PowerPoint, starts with the integumentary system. And integumentary system, integumento, is a combining form that means skin, or covering actually, more specifically. The suffix ary is one of many suffixes which means pertaining to. And ultimately, the integumentary system pertaining to a covering gives us a pretty good definition of what it is that the skin does. Its main function is to cover us. It keeps us from absorbing too much moisture from our outside environment. It keeps us from losing too much moisture from our outside environment. Okay? And so here on our chart, okay, we see the integumentary system. Okay. And then the next system of the body, the skeletal system. Well, the skeletal system is going to be created by our bones, our ligaments. Okay, ligaments connect bones to bones. And ultimately, the skeletal system is going to be the foundation for our entire human body. It's going to give us the scaffolding to connect all of the other structures. The integument that goes over top of it, protection for vital organs like the brain and the cranium, the heart and lungs in the thoracic cavity, the very delicate spinal cord and the vertebral column. All of those are going to be allowed to flourish because of the benefits in terms of structure and protection allotted by the skeletal system. And then the next system of the body, the muscular system. Musculo means muscle, and AR again means pertaining to. Muscular is going to be, the muscular system is going to be what ultimately attaches to the scaffolding that's the skeletal system. It gives us that foundation to now go from place to place or manipulate our environment. The muscles of our lower body allow us to move from point A to point B. And then the muscles of our upper body, especially the muscles of our upper arms and the muscles of our forearms and our hands give us the ability to manipulate our environment. And then we have the nervous system. The nervous system is going to be a very quick acting electronic system in our body. The electronic system allows us to react to what's going on in the inside of our body, as well as what's going on in our outside world, and we can respond to it accordingly. The circulatory system, well, the circulatory system is going to be composed of the heart as well as the blood vessels and the blood, and that gives us the ability to nourish all parts of our body, carry life-giving oxygen to all parts of our body, and pick up waste material that is created by all of our body cells undergoing the processes that they would normally go on a minute-by-minute, day-by-day basis called metabolism. The endocrine system, it's a system of glands which secrete hormones, and these hormones act like a second communication system paired with the nervous system to help us respond to internal changes as well as external changes. And it also, in response to our DNA, our genetic blueprint, secretes hormones during formative times of our development to allow us to grow and to allow us to take on secondary sexual characteristics in the male and the female, which allow us to ultimately reproduce. The lymphatic system. The lymphatic system is going to be a system set up to transport molecules which are just too large to be transported in the circulatory system. Large fat molecules that are created by our cells, large protein molecules. These are just too big to fit into the vessels of the circulatory system, and so ultimately they're going to get picked up by the lymphatic system. Also, the lymphatic system is associated with our immunity. Okay, the lymphatic system has lymph tissues like lymph nodes, and those lymph nodes are going to be important because ultimately they help filter this fluid inside the vessels of the lymphatic system. And if there's any kind of pathogens, which are foreign invaders trying to do us harm, these pathogens will be filtered out by the lymph nodes, and ultimately that protects us. Our digestive system, the digestive system is going to help us take food in, break that food down through the process of digestion, and then once we digest the food, absorb it, get the nutrients out of it, and make sure that all of those nutrients get transported by the circulatory system and allow us to rebuild tissues which get broken down, heal tissues that have been injured, or build new tissues if we're in our formative years and we're growing in height and growing in muscle mass. Okay, our respiratory system, we already talked about that briefly when we were talking about combining forms, and respira is going to be a combining form which means to breathe. Okay, and of course that's what we typically think of when we think of the respiratory system, our ability to breathe in and breathe out, taking in atmospheric air and ultimately exhaling waste products. The urinary system. The urinary system is going to consist of the kidneys, which filter our blood and extract waste material, specifically urea. And then ultimately, the urea, once we rid our body of it, the kidney's secondary function is to regulate fluid balance and acid base. Okay, so our kidneys, if we happen to have too much fluid in our system because we went to the Chinese buffet and we had all of that food that has too much sodium in it, that leads to a lot of sodium in our tissues. And of course, to chase all that food down, we've got to get rid of our thirst by drinking a copious amount of iced tea, and we gain all of this water weight. Ultimately, over a period of 2 or 3 days, when the kidneys get rid of the urea, the waste product in the blood, they also get rid of excessive amounts of water, and that helps us to make sure that our tissues aren't bloated up and we can ultimately get back to our normal weight and normal blood volume. And then finally, the reproductive system. Okay, the reproductive system is going to be important for us maintaining our population. If we don't have the ability to reproduce, we can't go on as a species. So potentially the differences in the male and the female reproductive system give us the ability to maintain our numbers. Okay, the male with his ability to create sperm, the female with her ability to have ova, that allows us to produce fertilization that ultimately leads to our ability to maintain a species, so to say. So those are our 11 systems of the body, and ultimately those 11 systems of the body working together help us to maintain what's called homeostasis. And homeostasis is going to be the body's very narrow boundaries that allow it to work at its optimal level. So as we progress through our medical terminology and anatomy and physiology, we're going to learn about the prefixes, suffixes, and other information associated with each of these 11 systems. And getting back into our McGraw-Hill resources, okay, I just wanted to vary from that for just a second. If we look at Table 2.9 from the McGraw-Hill resources, okay, prefixes of position. Okay, so we've studied combining forms, and the combining forms give us the foundation. We've talked about some different types of suffixes. Some of the suffixes may be adjective suffixes. Some of them may be diagnostic suffixes. In this case, we've got suffixes of position. And as we make our way down the table, we see ante, A-N-T-E, meaning before or forward. Okay, anti, against. Those are two that you have to be careful not to mix up. A-N-T-I means against. Okay, antibiotic. Anti means against. Bio means life. Okay. And T-I-C is going to mean pertaining to. Okay, so pertaining to, against life. Well, that's obviously something that we want to occur if we have been infected with a bacteria. We want something that we take in to be against the life of this bacteria. Whereas anti, A-N-T-E, meaning before or forward, antivert, okay, to tilt forward. Okay, for example, the uterus can tilt forward in some instances. Circum, around. Okay, that in this case is a prefix, and that prefix is closely tied to a term that we hear a lot about, circumcision. Okay, obviously during the young male's formative period of time out of the womb, okay, a circumcision may be performed to remove the foreskin from the gland's penis, and of course, that's been associated with a whole host of health risks maintaining that foreskin. So that's why it's typically removed. Continuing with prefixes, endo, meaning inside or inner, endocrine, okay, a gland that secretes fluid directly into the blood, epi, above or upon, epidermis, okay, the top layer of the skin, Exo, outside or outward, an exocrine gland, a gland that excretes outwardly through ducts. Hyper, excessive or above. Okay, hypertrophy. Tropho is a combining form that means to nourish. So to hypernourish would mean to give extra nourishment to cells, which would in turn produce extra growth. We typically think of that with working out and gaining muscle size, hypertrophy. Hypo, meaning below. Okay, the hypodermis, tissue layer below the top layer of the skin. Okay, inter, meaning between. Intercostal. Costo is a combining form that means rib. Okay, the space between two ribs, intercostal. Okay, inter, in, between. Costo, meaning ribs. Al, meaning pertaining to, between two ribs. Intra, meaning within. Intradermal. Dermo is a combining form that means skin. Intra means inside or within, so intradermal means to pertaining within the skin. Para, adjacent or alongside. Paranoid, having delusions of persecution. Paranoid, you might think that somebody literally is beside of you. So para, a prefix that means beside or alongside. Somebody who's paranoid might think that somebody's beside them watching, for example. P-E-R-E, peri, around. For example, perinatal, around the time of birth. Post means after, postnatal, after the time of birth. Pre means before, prenatal, before the time of birth. Supra, above or excessive, suprapubic, above the pubic bone. Okay, trans, across or through. Okay, transdermal. Dermo means skin. Transdermal would mean going across or through the skin. Ultra, higher or beyond. Ultra, sound, very high frequency sound waves. And of course, you've heard of ultrasound when getting a patient's medical report and seeing that they had an ultrasound procedure performed as a means to diagnose some type of disease. And continuing prefixes of number and measurement. Okay, bi, we've all heard of the term bi. You think of a bicycle growing up, bi means two. Bilateral, okay, means on two sides of the body. Brady means slow. I always tell my students when I'm teaching them medical terminology or when I'm teaching them EKG, bradycardia, cardio again we know means heart, Brady means slow. Well, I always tell them Tom Brady, the quarterback for the Patriots, of course, is slow. Nobody ever accused him of being a fast runner. So bradycardia. So they always can remember that. They think of Tom Brady when they see the prefix Brady, and they know that he's slow. Di is similar to bi. They both have the same meaning, meaning two. Diplegia, okay, paralysis of corresponding parts on both sides of the body. Okay, EU means normal. Okay, eupnea. Okay, eupnea would be normal breathing. Okay, hemi means half. Hemiparesis would mean weakness on one side of the body. Macro, we've heard all the time growing up, we've heard of a microscope, but the opposite of micro is macro, and that means large. A macrocyte. Macro meaning large, cyte meaning cell, a large cell. Okay, micro. Okay, again, we've heard this term many times, typically associated with a tool used to view very, very small structures, microscope. Okay, or in this case, a microcyte, a small red blood cell. Okay. Mono. Mono means single or one. Monocyte. Okay, a white blood cell, in this case with a single nucleus. Mono meaning one. Multi meaning many. Okay, multipara, a woman who has given birth at least twice. Okay, pan means all. Okay, pancytopenia, deficiency of all types of blood cells. You know, an example that I like to give students about pan is pandemic. Pandemic means something which is an outbreak that encompasses either entire continents or potentially the entire globe. People think of an epidemic as something that is severe and widespread, and it is, but it's typically a geographic region. Like I remember when I was in the Louisville, Kentucky region, one year we had a tremendous outbreak of the flu in the Louisville, Kentucky region. All of the downtown hospitals were on diversion and they had to reroute their patients to the suburban hospitals because there just wasn't a bed to be had in downtown Louisville in any of the hospitals. But again, that was just an epidemic, a relatively small geographic region. San Francisco wasn't having the same outbreak of the flu. Denver, Colorado wasn't having the same outbreak of the flu. So people sometimes erroneously think that epidemic is something that's massive. And in the grand scheme of things, it's only a small geographic region, whereas pan, the prefix pan, means all or all encompassing. So a pandemic is on a much grander scale than an epidemic. Poly means excessive, like polyuria, excessive production of urine. Polyuria means excessive production of urine. Somebody who is diabetic may produce a lot of very dilute, clear urine. Primi means first. Primipara, okay, is a patient who has given birth for the first time. Okay, a female that's given birth for the first time would be primipara. Quadra. Okay, quadra means four. Paralysis of all four limbs, for example, would be quadriplegia. Okay, tachy. Okay, I gave you the Tom Brady example earlier about bradycardia, Brady being slow. Unfortunately, I don't have a good tachy comparison, but tachy means rapid. Tachycardia would be a rapid heart rate. Tachypnea would be a rapid breathing. Somebody who's very excited, or maybe somebody who's run for a long distance and is now quite fatigued might be experiencing tachypnea. Tri means three, tricuspid. In our heart, we have the tricuspid valves. They have 3 points, okay, or 3 flaps in this case. Uni means single or one, like unipolar. Okay, unipolar might be associated with depression. Bipolar would be points of being depressed, alternated with points in time of being very, very excited and elated. Whereas unipolar would just be a form of depression, constantly depressed. Okay. Continuing with prefixes of direction and location, ab. Ab means to move away from. Okay, abduction. To move my arm away from my body would be abduction. Okay, to put that arm back down to my side, bringing it back toward the midline would be adduction. Ante, well, we already talked about ante, coming before or in front of. Again, antevert is to tilt forward. And in this case, the example we used a little while ago was an example of where the uterus was tilted forward. Post, coming after or behind. Postnatal, occurring after birth. Postnatal care would be after the birth of the child, the care that they would receive subsequently. Sub, meaning under. You know, submarine, for example. Submarines aren't known for going on top of the water. They're known for being underneath the water. And so sub anything means below or under. Subduro means in the space under the dura mater. The dura mater is one of the coverings that covers our brain and covers our spinal cord. And so something that is subdural would be below the covering of our brain or below the covering of our spinal cord. And syn, S-Y-N means coming together. A synapse, okay, a synapse is a junction between two nerve cells. So they would come together, and when they come together, it forms a junction between these two cells. And in this case, the cells are nerve cells. Everybody hanging in there still? Okay, good, good. Well, let me just take a second there to change things up and just mention again, on the McGraw-Hill site, when you're going through the ebook, for example, there are videos, okay, and there are images which you can blow up that give further detail of the information that we're covering. And so ultimately that helps you gain understanding of the material. And then of course the Learn Smarts are essentially the textbook, the ebook, but instead of just going through them page after page the way you would leaf through a book, the Learn Smarts have built-in quizzes. After you read for a certain amount of time, it will make you access and answer questions pertaining to the quiz, so that way they can determine how well you're comprehending the material. It will also highlight the most important information and help you to focus your efforts in that particular area, so you have a better understanding of what it is you've been reading over. Because anytime you go through this material for an extended period of time, you may have a tendency to get tired, to be kind of bogged down, and so on. And the little embedded quizzes and material that they've added to the site really help you to stay focused and ultimately remember what it is you've been going over. Well, the third chapter in the McGraw-Hill resource is really nothing more than learning how to deconstruct medical terms. And we've already been going over that as we've been speaking. You know, time after time we've encountered a combining form, which again I said was the foundation element of a medical term, and then we've combined it with a prefix in the front or a suffix at the end, and that in turn gives us a very distinct term. And so ultimately, when we go to deconstruct a term, we may be trying to deconstruct a term like dental. Okay, D-E-N-T-O is a combining form that means tooth. Okay, so D-E-N-T-O is a combining form that means tooth. A-L is a suffix which means pertaining to. So dental means pertaining to a tooth. So if you saw that term dental in a patient's record, you would know that it meant pertaining to a tooth. If we have a term like we had a minute ago, gastroenterology, gastroenterology has a combining form of gastro. Gastro means stomach. Entero means intestine. Okay, and then we said the suffix logy, L-O-G-Y, means the study of. So gastroenterology would be the study of the stomach and intestine. Okay, the study of the stomach and intestine. And so when we know the prefixes, suffixes, and combining forms, it's not that difficult to deconstruct medical terminology. Medical terminology that you would encounter in a patient's chart, or medical information that you might just have in normal conversation in the healthcare environment. Let's refer back to the printout, the slide presentation. And that slide presentation gave a number of common medical root words. And these common medical root words encompass all those 11 systems of the body that we covered, okay, that I briefly gave some information on a second ago. And ultimately, these would give us a tremendous vocabulary across all 11 systems, and will encompass many of what we would see on a regular basis when we are abstracting data from a patient's medical chart. And so having a strong knowledge of just these on these 2 pages really gives the medical coding specialist quite a strong database of medical terminology. So abdomino means abdomen. That's typically going to be associated with the digestive system. Abdomino is going to be associated with the digestive system. Adeno, meaning gland. Glands, of course, are going to be associated with the endocrine system. Antero, front. That's a directional term when we're talking about an injury that might occur to the patient, the front of the patient's body. An anterior injury, such as a burn to the chest, would be the anterior thoracic cavity. Okay, the front of the thoracic cavity. Arterio means artery, and of course that's going to be associated with the circulatory system. Audio. Well, audio is going to be associated with hearing. Bio meaning life. You know, everybody in school had to take biology, and all the material that we're studying now is human biology, so to say. Anatomy and physiology is the study of human life. So bio means life. Brachio means arm. When somebody goes to perform a blood pressure on a patient, they are going to constrict the brachial artery, and that brachial artery, when it's constricted, the flow of blood, when it starts to flow once again after the pressure is relieved, is what gives us someone's blood pressure. Bronchi and broncho mean bronchus. Those are associated with the respiratory system. Bronchi, broncho are going to be the tubes that allow us to bring in atmospheric air, extract the oxygen from that atmospheric air, and get that oxygen into the bloodstream at the level of the lungs, and then in turn pick up carbon dioxide from the circulatory system, because all the cells of the body, when they perform metabolism, give off carbon dioxide, and in turn those tubes are going to carry that carbon dioxide out of our airway passages, our oral cavity, our nasal cavity, and ultimately that gets rid of carbon dioxide. So bronchi